Hello friends, let us now learn some important points about micturating cystouretherogram. In micturating cystouretherogram, this micturating cystouretherogram is actually of two types. One, we have ascending micturating cystouretherogram or descending uh, micturating cystouretherogram. In ascending micturating cystouretherogram, contrast is injected into the urethra. Here, contrast is injected into urethra, and this is actually demonstrates it will demonstrate anterior urethra. This ascending type will demonstrate is used mainly for demonstrating anterior urethra, whereas descending type is mainly used to demonstrate posterior urethra. So that is one important type. In ascending type, it will mainly demonstrate anterior urethra, whereas in descending type, it demonstrates mainly the posterior urethra. So this micturating cystouretherogram, that is micturating cystouretherogram. We have one more term which is called as voiding cystouretherogram. It is similar to micturating cystouretherogram. Actually, both these terms do not have separate meaning. They are used interchangeably most of the times. But this voiding cystouretherogram will definitely it will demonstrate the lower urinary tract. There is no doubt in that. It will demonstrate lower urinary tract and it will detect some of the pathologies like it will detect vesico-urethric reflex if there is any, or if there is any bladder pathology. It can be helpful to demonstrate the bladder pathology, or if there is any congenital or acquired anomalies of the bladder outflow. If there is any congenital or acquired anomalies of bladder outflow, these can be understood by bladder outflow tract voiding cystouretherogram. Now, so in micturating cystouretherogram, what are the indications of micturating cystouretherogram? If you see indications, this micturating cystouretherogram indications can again be divided into either in children and in adults. So first we will see the micturating cystouretherogram indications in children. Okay, in children, in micturating cystouretherogram is useful in urinary tract infections. Usually, this urinary tract, whenever the child presents with urinary tract infections, it is done after some weeks of acute stage, or it can be done under antibiotic coverage. It can either be done after acute stage or it can also be done under antibiotic coverage, either under antibiotic coverage or it can be done under acute stage. Okay, one more important thing is if the patient has UTI, it's MCU, that is micturating cystourethrography, is indicated if the child has first time, if the child has UTI. If the child has UTI in the first time, then we do micturating cystouretherogram. Is always advised to rule out any anomalies which are seen in children. Then UTI in child. Next, if the child presents with any voiding difficulty, like if the child has any of the voiding difficulty symptoms, like either if the child has dysuria, that is pain on urination, or if the child presents with thin stream of urine, or if there is dribbling of urine or frequency of urine, in all these conditions we can do micturating cystouretherogram. Then if the child presents with vesico-ureteric reflex or any congenital anomalies, if the child is suffering from any congenital anomalies, like if the child has meningomyelocele, if the child is suffering from meningomyelocele or sacral agenesis or rectal anomalies, any meningomyelocele, sacral agenesis or rectal anomalies, in all these conditions we can do micturating cystourethrography. Similarly, prior to urinary tract surgery, any type of urinary tract surgery, before urinary tract surgery, in order to know the baseline, for baseline, we can use this micturating cystourethrography. It can also be used as post-operative evaluation also. It can be used as post-operative evaluation of ureteric abnormalities. For them, we can use this micturating cystourethrography. It is also used in pelvic trauma. Then, this micturating cystourethrography is also used in renal failure. In renal failure, it is used in order to exclude the reflex. We can use this in micturating cystourethrography. Next, it is also used in boys with hematuria. In boys with hematuria, also we can, if the child presents with hematuria, then micturating cystouretherogram is done mainly to demonstrate if the patient has any posterior urethral valves. So for this we do, or polyps. For this we do micturating cystouretherogram. Next, what are the indications in adults? So if you see in adults, the major indications in adults, if you see a micturating cystouretherogram is indicated if there is any trauma to urethra. To find out whether it is anterior urethral injury or posterior urethral injury, we can use this micturating cystouretherogram. Micturating cystouretherogram. Similarly, uretherogram. Okay. Similarly, if there is any urethral strictures also in the adults, to find the site of the strictures, or if there is any suspected urethral diverticulum, in order to find the site of this urethral diverticulum. So in all these conditions, we can do cysto-urethropography. Next, if you see other indications like micturating cystourethrography can also be used in UTI or reflex nephropathy. It is also used in reflex nephropathy. Especially this is done prior to renal transplant also. Prior to renal transplant of one or both kidneys, we can do this micturating cystourethrography. Next, it is also used as follow-up. It can also be used as follow-up in spinal cord injuries. Also, we can use this micturating cystourethrography. So, mainly these are the indications of micturating cystourethrography. Thank you.